low PCV and WBC counts. Thank you.
Thank you, from Priska, for that question. Famoke, I hope you are still here with us to answer this question. But before you come in, I know that filgrastim is usually a standard of care added to every regimen, preferably the PEG filgrastim that is one shot after each cycle, because neutropenia is an expected side effect and is usually very severe when it comes. So it's always been prevented with that shot of filgrastim after each cycle. If I'm okay, you can come.
Okay. So first and foremost, the key thing here is what kind of regimen are you giving to your patients? Because if NCCN's guidelines also have it graded, the ones that will cause greater myelosuppression, the kind of regimen that cause moderate to mild myelosuppression. So for those with severe potential to cause or moderate potential to cause myelosuppression, you may have to do your filgrastim to support your patient. And for patient with mildly or no, you may have to hold on depending on what the absolute neutrophil counts for your patient at that point in time indicates. Another thing there is nutritional status of your patient. How well are these patients feeding? And the performance status of your patient. At what performance status are you starting this chemotherapy? Then the age of your patient. Patients who are elderly, their tendency to develop myelosuppression is greater because their blood counts don't recover as fast as it should. And then patients who already have a history with myelosuppression, probably from a former confinement in the hospital. So you have to go through a patient folder, find if they already have a history of that. So you then start considering at what you can do to help prevent it. But the point still remains that if we are not taking away what is causing the problem, how much can we prevent it? And we can't take away what's causing the problem because we know that medications some are severely myelosuppressive. So if we can't take it, we just have to find a way to live in peace with both myelosuppression and treating the patient. So somehow we have to find a middle ground. That is why we as the oncology pharmacists are there. That is our core competency. We must find a balance between how best to manage this patient, considering that we're expecting and we know that these things are bound to occur because what is causing it is what we are using to treat this patient. So preventing it, to some extent, you may not have a very, very, very good and expected result from preventing it. But if the patient has a good nutritional status, like I said, and then the patient is properly managed through the course of therapy, they tend to do well. That's what I can add on that. Thank you.
Thank you so much, Famoke, for that submission. There is another question on the chat box. I observed, maybe I didn't see it due to my network. I observed that the harmonized NCCN guideline doesn't give room for palliative care treatment for patients. That's not true. Famoke, can you say something on that? That harmonized NCCN guideline does not give room for palliative care.
Harmonized NCCN guideline has a dedicated guideline for palliative care and survivorship.
Yes.
They have a dedicated, so you need to download the app, then go to harmonized guidelines for sub-Saharan Africa, not the one for Southern America. Then you're going to see all of that. You can download all into your phone. The file size is quite small. That's one good thing about that. It doesn't fill up your file size as much as TikTok do. The file size is small. It doesn't fill up your phone. And it's a reference that every one of us as an oncology pharmacist must carry about in our phones. You must have it handy because oftentimes The key thing for me practicing in oncology is that I understand that I don't have to know all the answers. I also know that I just have to know what are the critical questions. So once I have the right questions, I can find the answers. That's my take on it. Thank you.
Thank you so much. I think we've been able to answer all the questions. I cannot see any other hand up, except someone wants to make a contribution or a suggestion. Any other contribution to today's topic? So, in absence of
I
any
want
other
to guy eat
comment,
party rice.
in the absence of any other comment, we want to bring this presentation today to a close. We appreciate the Faculty of Clinical Pharmacy, West African Postgraduate College of Pharmacists. We appreciate OPAN. We appreciate our facilitators. You guys have always been making us proud. Thank you so much. Our today's presenters, our HOD, Pharmacist Mrs. Abasiatai. Thank you so much, ma'am. We want to appreciate Fam Bernard, Fam Gentle, and Fam Eno. Fam Eno, can you just say hi to the house because you're part of the
Heard
team.
your voice, oh. We've not heard her voice.
Yes, Fam Eno, just say hi to the house. She's here with us. She's part of the team that prepared the slides for today's presentation.
Hi, good afternoon, everybody.
Good afternoon. You are highly appreciated.
Thank you.
We look forward to seeing everybody in Abuja on May 11th to 13th, 2026. Remember, our hands-on training is on 11th, and we have partners joining us all the way from Germany for that hands-on training. Make sure you are there. Please, if you've not registered for your conference, please register for your conference. It's just 30,000 so that we can plan for your conference materials. Make sure you get your materials. Pay into open account, click on the registration link and fill the form. For you to participate in the hands-on training in Abuja, it means you need to be in Abuja by 10th of May because the hands-on training is starting 9 a.m. on Monday, 11th of May. So see you there. Thank you, everyone. See you. Have a nice weekend. If you invite me, I'll come and join you for the weekend rice, please. The network tried us today.
Bye-bye, everyone. Thank you.
Bye, everyone. Thank you. Bye. Enjoy the rest of your weekend.
Yes,
Thank you very much.
We pray that next week that the network will be good. MTN is back. MTN just came back now. Imagine, after putting us through so much.
Welcome to them. Let's keep them for next time.
It's not funny at all. It's well. Thank you, everyone. See you guys. We'll share the presentation slides on the forum. So presenters, please send me the updated version of the slides. Let me share for the participants. Bye, everyone.
Bye.
The recording has stopped.